to put this virus in a corner where we manage it and not the other way around. We need to adapt our daily lives to the need for hand washing, physical distancing, and other control measures. And at the same time, we need to build protective supports into our social fabric to provide long-term protection against future waves of COVID-19 and future pandemics of emerging disease. We know that people who are infected with COVID-19 will develop some kind of antibody response. And that will probably provide some level of protection. We just don't know what level of protection, how strong that protection is, and how long it will last. I think that's the sort of scientific discourse right now. So that's why those studies need to be done, and that we should be cautious about how we interpret the results, for example, of some of the serologic testing. But I know that so many countries in the world, and now including Canada with the Immunity Task Force, we're going to try and get to the bottom of those answers. But right now, we just don't have enough information. Our sort of approach, though, is to make sure we get what is inside Canada well managed, well controlled, and moving towards that new living with COVID-19 as the primary step before we can consider what we need to adjust from an international perspective. First cautious step is ensuring that people can get outside and get the type of physical activity that they need while maintaining public health advice. And so, but I think in terms of different sectors, we provide certain parameters. You can do a risk assessment, of course, of the different sectors, as in the number of contacts, the intensity of contacts, the ability for them to adapt. I think the idea is to encourage people to think ahead, submit their plans to public health, and see it would actually meet public health requirements. But I have to admit that we haven't actually specifically talked about that setting as yet.